existing in a different economy. The issue of fuel will still come into play, issues of inflation. So much as we are looking at the targeted program, it's important that the economic environment is also one that is viable for them. I think there was a comment on the financial model. Of course, we don't have a model that we can present, but certainly I think working with entities such as Zamstats, considering that they do cover a larger scale, it's quite important that we're also focusing on some of the data that is coming out. And we're quite happy that the Living Conditions Monitoring Survey has been produced. Working with statistics from 2015 has not helped us, and we do hope that we can work with these numbers more frequently. But maybe just to speak to the last question from Honorable Musanje around debt forgiveness, basically what is the relationship, even when you're looking at poverty. I think it's important to note that Zambia does not exist in isolation. Russia-Ukraine war has affected us. When you look at official development assistance, everyone outside is also tightening their pockets. So that's where domestic resource mobilization becomes quite key, even for our developmental programs. We can't rely on external assistance because sometimes it's just not there in times of crisis. And of course, we also can't anticipate. I think I'll end here for now. There should have been one more question.
Yeah, just to add to the conversation, I think I'll start with the last one on stocking of facilities, especially the medical facilities or healthcare facilities. Who should stock? Is it CDF or is it the central government? Certainly with the current standing, it should be the central government. So of course the CDF will, with its objective, will provide the infrastructure development or contribute to that. But when it comes to maintenance, I think the ministry strongly comes into that. I think we'll just have to keep an eye on how the turn of events will be when the implementation of the 2023 decentralization policy goes deeper. And then speaking to the appropriate intervention around social cash transfer and escaping the poverty loop, I think a number of factors have to be considered. So I think from our end, firstly, we are saying we need to do a research and see how a family can survive on this. So in terms of looking at or doing a research, we should consider the number in that household, the viability or the capacities in that household, and then of course the external environment in terms of the economic outlook, the macroeconomic fundamentals. How are they impacting on the cost of production, accessing other facilities? And so the other appropriate then intervention would be capacity building for those vulnerable households, but they have capacity to do something. So capacity building, and then aside from capacity building, they would need some physical support, which can come in financial manner. And that's why we are alluding to other government programs like CDF, CEEC loans, where they can access these to support themselves. I think on debt and poverty levels, it's an interesting question, especially when we look at vulnerable households and how debt servicing often has impacted on social sector spending when it comes to these very vulnerable households accessing things like health, education and other social services. So again, it would be good to relook at another cycle of debt, or phase of debt discourse in Zambia. Thank you.
Honorable Chinkuli. And
thank you. Thank you so much for those responses. But I'm still left behind in a sense that I think we are looking at something that there's no progress in whatever we are doing. Funds, you agree with me that funds, more especially on social cash transfer, are released, they are given. Now the question is, when these funds are received, how are they utilized by the recipients? Is it just from hand to mouth, then from there sit and wait for another allocation? Someone made reference to unemployment benefit, where people in the Western world who just wait for, once they sign, they get and they go. But there was no progress. Till finally, just said, no, this one will only sit for, is it a month or two, thereafter you are off the list. So I'm trying to look at some intervention that should be put in place to ensure that these funds, no matter how small they are, they can be utilized so that people are able to, empower themselves. And so I fail to understand why we should keep on, having these same complaints. A lot of, people saying, no, can the funds be increased? With the small funds that have been given, how have they been utilized? Then once we establish that and see that, okay, these funds, they have been, utilized in this manner, and they need some top up, we need to justify as to, because I can rest assured that we cannot manage to be feeding people every month, every day. We can't. And there's no one who can. Someone just seated. So why can't we find some, some measures that can be put in place so that these people, once they receive these funds, they put them to good use? I submit.
Okay. Honorable Musanje, then Dr. Katak.
Thank you so much, Chair. Again, just some follow-ups. One is, since you released the this basic needs food basket, I'm wondering why you do a very good report on releasing the basic needs basket, but you shy away from giving us solutions to be part and parcel of your package. You are an evidence-based institution, so we would expect that when you release the basic needs basket, you also come up with the interventions that needs to be taken. For example, right now we've got rising food prices again. I think we saw that in 2016. We had that challenge, and again we have rising food prices right now, and we would expect to see your response to this question of rising food prices, so much that ministries like community development, that is meant to intervene where citizens fail, can then get some of the solutions from yourselves. But when I look at the recommendations, I find that the recommendations are all pointing to already existing government pronouncements. So we are looking for new evidence from yourselves as research institutions to help us, to help the government with new ideas of things that maybe government may not be pointing, than pointing us to already existing government solutions, the social cash transfer, the CEC loans, the cooperatives and the like. I think that's the current model already. So what is it that is new that you can put on the table to help intervene on these issues that are facing the country, especially the rising food prices and to impact on poverty? Thank you.
Okay. Honorable Katakwe.
Thank you, Chair. Just sit here. I appreciate your efforts in terms of research, and just drawing your attention on your conclusion. Zambia is rich in terms of natural resources. That I believe you also agree with me. Then we have 60% of the population being identified as being poor and others, in extreme poverty. Where do you think Zambia has gone wrong? On one hand, we are so rich with the natural resource, which, if we were honest, actually this percentage we are talking about in terms of poverty can actually be zero. But where do you think, from your research, where do you think we have gone wrong? Thank you, Chair.
Okay. Honorable, you can answer the third one. You can ask.
Thank you so much, Chair, and thank you, Jesse Tiara, for your presentation. I wanted to find out from you the modalities that you use when it comes to, the food basic needs food basket, dynamics are different, in the cities and in rural places. We come from rural places. So when you come up with this basic needs food basket, is it just unique to people in cities, or do you have a different one to people in rural areas? I'm alive to the fact that in rural areas, like in my constituents, issues of fuel, do not really affect our people, because mostly it's just like, they have to walk to markets and stuff like that. So do you have something like basic needs for people in rural areas as compared to just the general one that you always present year in and year out? And the second one is, the second one I want to bring to your attention is that there's been low absorption of monies in the Ministry of Health. Each time money is allocated, sometimes the ministry ends up not spending all the money that is allocated to them. What do you think we can do to improve the situation where we increase the absorption of money in the Ministry of Health?
Honorable Chala.
Thank you. I want to find out from you, cash transfer, we are giving them 200 kwacha per month, okay? What can you recommend? How much do you think in your recommendation that these people can be receiving? Thank you.
The last one. Okay, you can ask. I think it's now time for you to answer these questions.
Thank you so much, Chair, and thank you to our honourable members for these interesting questions. So perhaps there are 1, 2, 3, 4, 5 questions. Let me try and deal with them in turn. How are the funds utilized for social cash transfer? I think the first question. Excellent question. I think that from a Catholic social teaching point of view, the principle of subsidiarity means that we have to make sure that people stand on their own 2 feet. We cannot keep supporting people indefinitely, because that is not part of our dignity as human beings. As human beings, we need to be employed, and employment is a way to express our own human dignity. And so it's a temporary measure. Any kind of social assistance of this nature is temporary, as far as the understanding of JCTR is, and it is merely to help in times of crisis, to direct people towards sustainability. So the essence of your question is an excellent one. We need to help people to stand on their own 2 feet, and that's also all about the human rights-based approach, which is what we follow in JCTR. So perhaps with this, my thought in terms of your question, seeing that it's a crisis-linked fund, so to help people through current crises, my thought was, what are the current crises that we are going through that we could help people with? And we've identified that in our memorandum as, amongst other things, climate change, pests, etc. So a part of the answer to your question might be to get a better understanding of the actual crises that people are facing on the ground, which means that they cannot have financial stability now. Climate change is a huge problem that we're dealing with, and Pope Francis has just released a document yesterday encouraging the world community to take it more seriously. And I know that Zambia is taking it seriously. And we are doing a number of different projects that are directed at combating the impact of climate change. So again, I would point towards a multi-sectional approach. social cash transfer, I take it your question was, is there a way to kind of ensure that the money is well spent? I'm not sure I would have an answer to that, response to that point. My only other response would be that we need a multi-sectional approach, have social cash transfer, which is not enough to help people per household, but we need that and other programs and focus on the challenges of the day. I suppose that would be my kind of sense of that. In terms of well, I don't know how to do this now. Do I let my colleagues come in, maybe, on that question? Go ahead.
Thank you so much for the questions. I think I'll just give some general responses on questions related to the work that we oversee. And maybe just as a contribution, I think the question around social cash transfer, the program possibly having not seen progress in terms of utilization. With partnership from Save the Children, what we have tried to instill is something called child-sensitive social protection, where beneficiaries from the behavioral component are actually advised on how to use the money. Unfortunately, social protection at the moment, social cash transfer to be specific, doesn't have a law that governs expenditure. Namibia is quite progressive in that regard. Perhaps those could be reflections for future use, because someone could receive 200 kwacha and simply use it for anything that they want to. So there's also an aspect of behavioral change in as far as awareness, but also I thought I could just emphasize the group of people that we are looking at, even when you look at the criteria, the elderly. For them, some of them can't be in productive capacity, so the program itself is designed in such a way that it's taking care of those least that cannot afford. So mainly they will use it for basic needs, access to health, in the absence of NEMA, free education, which is a plus on their side. I think one way that we can help these households possibly mature, and this is something that's already in effect, is the Cash Plus program. In the past it was called double dipping, but now Keeping Girls in School, for example, will come from a social cash transfer household, putting relief on the beneficiary to use that money for nutrition or for something else. That would be a very quick comment. I think for Honorable Musanje, you had spoken to the basic needs basket and how we do shy away from solutions. I think for purposes of this memorandum it was broader, but I think in other submissions, for example, towards agriculture, we definitely aim to always provide solutions, and would also not just target policymakers, but even households. And I'll give you the example of roller mini meal versus breakfast. That is nutrition. Even if it was available in the markets, people just assume it's for the elderly, it's for those who are sick, but there's also that narrative where even households have a role to play in as far as nutrition. But pretty much the two interventions, it's either we deal with the income-based approach or the cost-based. If you can't bring costs down, how do we alleviate people to get to a point where they can afford? And I think we do have some material on that, and we'll definitely be ready to share. Indeed, no, I think that one is well noted. There was a question on the food basket and dynamics. The popular basket, and I'll use the word popular loosely, is the urban basket. And this is where we conduct it in 16 districts, usually along the line of rail. But we also have a rural basic needs and nutrition basket. And rightly put, when you look at the rural side, the context is very different. We're looking at consumption patterns. Most of them go to Gaisha their mini meal. They consume wild fruits, not apples and bananas. So we approach it from that context. But I would say, due to funding issues, it's a very low context. We piloted it in Magoye and Hamududu, which are actually rural areas. Hamududu in Kawe, Magoye in Mazabuka. There was a question around low absorption, I think, on health. Possibly just to emphasize issues of budget credibility. If the planning itself, are we under targeting, or are we not actually dispensing these funds at the right point that they should? I think if we can enforce the component of budget credibility even with health, despite where we've been mad with challenges in as far as procurement of drugs and medical supplies, I think it becomes quite important. The last one that I'll comment on is the cash transfer. What is our recommendation? It's a very hard question to answer because we all understand where we are in terms of the treasury. But if we say double the amount, as an example, from 400 to 800, we are pushing people closer to what will take them to their basic needs. Of course, any amount is welcome, but I think we need to interrogate, even with the living conditions, when we look at the poverty line, can we also define it in monetary terms so we can move and try to get people there? 400 kwacha was sufficient a few years ago. I think it would call for entities such as the Zambia Statistics Agency agency to also give us that broader scale, and we are very happy to collaborate with them.
Okay. Okay.
Just an addition, I think there was a question on natural resources and then our state of like, in a way to say, rich country, poor people. You know, so if I'm to answer the question, where have we gone wrong? I think, first of all, we should start looking at our economic model. Of course, we've taken much of a capitalist economic model where we would look at three issues: labor, capital, and profit. And I think we've invested so much in providing labor, you know, so we are looking only at providing skill set. And I think if you look the themes of the last three budgets, they are talking much about investment, economic growth, and not so much about harnessing the resources that we have. So in terms of where we can invest, our recommendation would be first to look at the policies governing the harnessment or harnessing of these resources. I think as we talk about investment, probably it would be good to begin heightening the conversation, especially around harnessing natural resources, the 50-50 shares. You know, some should begin, we should find in our model a way of retaining the profit within, beyond just providing labor. So we have the capital, we have the labor, but the profit. And then I think the other issue would be to start thinking of more of how we can invest in technologies around those investments, especially hearing new conversations around sugilite, gold. Sooner or later we'll hear we have gas, we have oil. So we should start thinking about, if Mozambique has gas, probably there should be some symptoms of us having also natural gas. So we should start preparing ourselves for that. In terms of social cash transfer, I think we can just bite the bullet sometimes and think of why can't we use the minimum wage, you know, because the theory behind the minimum wage is about beyond consumption. So I think the underlying philosophy of the minimum wage in terms of the discourse around employment, probably can begin to push that into the discourse around social cash transfer, because the theory behind the minimum wage should be somebody to be able to meet at least immediate demands and probably some future eventualities. So social cash transfer, if thought in that way, in terms of amount, I think it can have, because there shouldn't be much discrepancy between one working minimum, the minimum wage. I think it's now at 1.1. Yeah, around that. It's around that much. In terms of sustainability, I think the conversation you brought about, it's to escape this idea of social cash transfer being like, you know, a painkiller, like an opium. You know, you take it, tomorrow you need to go back, but you're not curing. So I think going with the minimum wage and going by your suggestion, if we developed a model, probably it could give an idea of how others who are viable, apart from those who are really vulnerable, how they can escape that loop. And then just talking to food prices, the rising. Of course, in terms of our recommendation, food prices in the sector of food security, there would be an issue of food production, food distribution, food supply, and food consumption. So when we look at, I think, the current scenario, it's an issue of now investing more into food production. So when we are looking at households, we know with the coming of climate change, if you are going to go and do maize only, the likelihood that you'll be in a disaster is quite high, as compared to somebody who would have diversified, you know, soya, sorghum, cassava, maize. One of them would survive. So in terms of that, I think in terms of food security at household level, food production, especially at household level, should be considered. And then when it comes to food supply, that's why we look at food markets, the policies around and the costs in terms of food. So in terms of our recommendation, we'd look at all those interventions, but also the aspect of food consumption, the nutritional content.
Okay.
Thank you.
Thank you very much. Before I
Just
give...
a follow-up.
I wanted to ask our staff if they have something to comment on the same. Let's give them chance. Okay, you can go ahead.
Sorry, Honorable Marita. I just wanted to commend the JCTR for the work they have been doing with us for some time. We, under the EU support, we've been trying to sign an MOU. One of the members, as you can see, our colleagues have information on the ground, and they've been so useful. The issue of sector budget analysis, we've communicated to them, and we hope they can be on board. This is the first time you are appearing before a portfolio committee looking at the budget. And I know that there could be a few things that you are still also grappling, like we are also grappling with. And because of that, I thought that maybe I should just give you a perspective that this committee oversees the Ministry of Health and the Ministry of Community Development. And we are very happy about your presentation, for instance, on the Ministry of Community Development that has highlighted the programs. And you can see the interest from the members, the social cash transfer issues. And we hope, and we might come to you because we need to write a report which will justify, give a business case for continuity of this sector budget analysis. We might come and get more information on the Ministry of Health. There are programs as well. And we know that there are allocations of resources that are going to those programs. We want to come and talk to the Ministry of Health when they come, whether indeed they should receive more money. So we'd be asking you to help us, like the members are interrogating, should you justify more resources? What have you done with the previous resources? So going forward, we'll be able to ask for information in that regard so that you help us approve the budget responsibly for these institutions. I just thought that we should bring that information. Thank you so much.
Okay. Thank you very much. Dr. Katakwereni, Dr. Honorable Marita.
Yes, Chair. For me, I think the issue, in one hand, I'm so rich. The other hand, I'm so poor. I want you to really punch that because you'll be able to help us to make this oversight on the executive. I look at Singapore. A few years ago, it was just a poor country, but today, it is a developed country. What is it? Is it, you've mentioned the capitalist model, this and that, but I think there is still something that you need to punch more. Thank you, Chair.
Okay, thank you. Marita, you are the last person. We've got another witness outside waiting.
Okay, thank you. I want to draw my line of thought from page number 16, where to say the food security pact was initially meant to empower poor, vulnerable but viable farmers. Obviously, since it was introduced in the late 2000s, we haven't seen most of these farmers attain their viability. So I wanted to find out from the Jesuit Center for Theoretical Research, apart from the recent interventions we're trying to do to help these people to attain their viability, maybe to increase or improve their livelihood. I've seen a lot of MPs through the increase of CDF. They have bought earth-moving equipment, which is helping to open up the rural area, obviously building better resilient roads, building crossing points, which improves the movement of goods both to the production area and to the market. Mechanization of production. A few MPs have bought farming tractors to help the farmers. I can give an example in my constituents. We have gone to further even to help plow for these vulnerable but viable farmers for free to ensure that they increase the hectareage. What other intervention can we put in place to ensure that we tap in their viability so that they don't perpetually continue being on this program for a long period of time? Thank you.
Okay. You want to ask also?
Yeah, so mine is simply a recommendation based on this wonderful interaction and considering your strategic position in research and development as a JCTR, that probably at an appropriate time. I know last year we had an interaction through, was it one of the caucuses? We had some interaction. Maybe we could have some more time, if you can, at some stage for us to discuss about that modeling for us to impact on poverty, how we can put various modeling measures to impact on poverty. In other studies, it's been shown that with what we are doing right now with social cash transfer, we can impact to the level of reduce poverty by about 3.5% in the next, I think, 2 or 3 years. Now, we would like to see, to put a longer term model, and to me, I'm looking for research partners like yourselves to invite us to discuss and dig deeper into that so that we can see how we can actually present something tangible to say if we put these interventions, we can result into this level of impact on reducing poverty by intervening like this and then at this level for this number of years. Yeah, thank you so much.
Okay. I think it's time now for you to answer those questions.
Chair, thank you so much. Just from my side, a few quick responses. This theme of so rich on the one hand and poor on the other, I think what we've been doing so much work recently on CDF. It's a hot topic at the moment, and we have been doing studies to see how the CDF is being spent and whether all the money is being allocated, that has been allocated, is being spent in a transparent and accountable way. And so one of the recommendations that we have, or at least we would like to engage the government on, is how to make sure the CDF, because there's a lot of money now allocated to the CDF, but the burn rate is very, very low. So I know that the government is planning on getting the burn rates up of CDF. We are wanting to help the government to ensure it does that in a transparent and accountable way. And then that leads us to transparency. You want to make sure that the money allocated in budget areas makes it to the beneficiaries. And corruption, unfortunately, means that a lot of that doesn't make it to its end destination. So transparency, again, accountability is what we would want to kind of strengthen and work with. Just in terms of farmers, what other interventions can we have? Agroecology is another hot topic that we are very interested in at JCTR. We have a number of projects that are dealing with agroecology. I know that the government will be implementing CATSIP, the program, at the end of the year, and that encourages, of course, fertilizers, and agroecology focuses on organic fertilizer, for instance, which is cheaper. So agroecology is not only cheaper, sometimes significantly so, but it is also more resistant to climate change. So what we would recommend perhaps is more investment in agroecology at the farming level. And just to welcome any invitation to engage further on financial models, and you're very, very welcome to engage further.
Okay. Thank you. You want to say something?
Just a quick comment, I think, to the question around why we are not where we should be. I think, broadly speaking, to be honest, it's a governance issue, and that cuts across the work that you do on various arms of government. Of course, where policy is concerned, I think we've already identified, we have the 8th National Development Plan. The sectors that we have are very clear. How do we ensure that policies are actually going to see us get to where we are with tourism, with mining very sensitive, especially where issues of corporate income tax is concerned. But as a center, even with the debt discourse, what we are saying is if illicit financial flows will equate to how much we are actually owing as a country, then something is wrong. So I think we need to enforce governance at various levels, be it from ACC in terms of the respective units that will enforce certain measures, but also from National Assembly. I hope the honorable members are curious now to know how far have we gone with the 2023 annual borrowing plan as we debate the 2024 borrowing. It's quite important that we look at expenditure as well, contraction and expenditure as well. In simple terms, that would be the quick feedback to that.
Thank you very much. It was you wanted to say something? We are out of time. Okay. No, thank you very much. It was a good presentation, and we have interacted well. But before you go, since you were given an immunity, I'm going to remove your immunity so that when you go out there, if you're going to say anything, you'll be on your own. We are not going to defend you. Thank you.
Thank you, Honorable Chair. Thank you, members.
Thank you.
Congratulations. I have a message for you. God has sent me to you. I have a message for you. God has sent me to you. Listen, them say, them tell you, say you can never be the one. But God say, make I tell you, say now you in June, in 1 month, in 1 week.